Okay, good morning, everyone, and welcome to our book review session today. This is the first book reviews in 2026 in Etikas Bali. And this book review is organized by Etikas Bali. And thank you for joining us today for all the participants. We are pleased to have a participant from diverse backgrounds such as lecturers, academics, and students who share common interest in health promotion. And today we are joined by our special guests or our special speakers. There are three speakers that author that the book that we'll be talking about today. And for all speakers, thank you for being here and taking the time to joining us today. Okay, before we start the discussion, I would like to introduce myself first. My name is Arya Mahaputra. I'm a lecturer in Etikas Bali, especially in medical surgical nursing. And now I will be your moderator in today's session. I'm truly honored to be a moderator today, especially given the relevance of the books today to the current nursing practice and health promotion. And I will be explaining about the agenda for today. So this event will last for approximately 1 hour until 2 hours. And the agenda will begin with the introduction for distinguished our speakers, and followed by a question and answer session from me and from the participant. And we will conclude the presentation by the token of appreciation. And for all participants, now we move on to the first agenda that we introduce our speakers. And the curriculum vitae of speaker will be displayed on the screen. So you can see the curriculum vitae for each speakers in the screens during the introduction. Okay, let's moving on to the first speakers. Okay. Our first speaker is Prof. Virtu Solita Porcia, PhD from St. Paul University, Philippines. She brings extensive expertise in environmental health within nursing, particularly how environmental factors influence health promotion and patient outcomes. Her perspective in this book highlights the importance of environmental as an essential dimension of holistic care. So the first I will be reading for Professor Porcia. Good morning, Professor Porcia. Warm greeting from Indonesia.
Yes, good morning, good morning. Thank you for having me here. Thank you
Thank
so
you for
much.
joining us online despite the distance.
Yes.
We are delighted to.
I'll see you later.
Yeah. We are delighted to have you with us today, and thank you for your perspective of international perspective. Okay, now let's move on to the second speakers. Our second speakers is Associate Professor Igede Putu Dharma Suyasa, PhD, from Etikas Bali. He completed his doctoral studies at Flinders University, Australia, bringing an international perspective to his work. And he has a strong expertise in activities of daily living among elderly, particularly in promoting functional independence and quality of life. In this book, his contribution emphasizes how daily activities are a core component of holistic health, especially in aging population. So please welcome Associate Professor Dr. Putu Dharma Suyasa.
Good morning, Bapak Arya, and good morning to everybody. Prof. Porcia, good morning. And hello to all our colleagues in Indonesia and in the Philippines. Very good morning. Thank you.
Thank you. Now we're moving on. The last but not least, the third speaker is Assistant Professor Niluh Dwi Indraini, PhD, from Etikas Bali. And she completed her doctoral studies at National Cheng Kung University, Taiwan, adding global perspective to her expertise in occupational nursing. Her expertise lies in the occupational nursing with focus on worker health, safety, and well-being across different work environments. And in this book, she contributes important insights on integrating occupational health into holistic nursing framework. So please welcome Dr. Hila.
Thank you. Thank you very much, the moderator today. And I would like to say a hi to everyone, including the online, because we do the hybrid for today. Thank you.
Thank you, Dr. Hila. Before we start to the discussion, I would like to invite all participants. If you have a question, you can write the question in the YouTube's comments. But please remember, state the name of the speaker, who you address the question. Okay, now begin our discussion. The first, maybe I would like to ask a general question for all of you. The question is, what was main motivation to create your books? Maybe let me start the first question to the Prof. Portia first. Hello, Prof. Portia. I'm sorry, Prof. Portia, I cannot hear your voice.
Yes, can you repeat the question, please?
Okay, thank you. Okay, the question is, what was main motivation or what the issue that you triggered to create your book or your model?
Oh, yes. My inspiration will be always Florence Nightingale. I really love the issue about environment. I really love talking about the link or the relationship of the environment to the health of the people, whether I am talking of prevention, curative, or rehabilitation. It has something to do with environment. So my advocacy is really to save the Mother Earth. So that is my inspiration from our own very first modern mother of nursing, Florence Nightingale.
So you figure out the Florence Nightingale to be your background to writing your model, right, Professor?
Yes, because my exposure in the Department of Health Philippines, my first job, and exposing myself and I think working in USAID projects and World Health Organization, I think it makes me realize that there are many diseases that caused by the environment. So we do have, especially in Asian country, we do have a lot of new tropical disease, and I think it is related to environment as well in our lifestyle. I think it's about also our environment that can connect also to all the non-communicable diseases. That is my inspiration.
Okay, that's very insightful to hear that. Okay, now let's start to the second speaker with the same question. Let's invite Dr. Putu. So what the main motivation to create your book?
So thank you. My name is Putu. Putu in Bali means the firstborn, but in some language in Indonesia it means grandson. So actually since the beginning of my nursing education, I always interested in healthcare for the older person. So that is why I focus myself on gerontic nursing. In Indonesia we call it gerontic nursing instead of gerontologic nursing. So this book is about mental health and it's about independence in activity daily living. In the last 4 years, I involved quite significant in the strengthening the case management process for older person who needs long-term care. So at the time that I'm working with the older person and the family caregivers, I found that depression impact hugely on the daily living activities. So I try to bring out this concept in the books, and then I published the book, of course with the help of so many people, my colleagues and older person also had shaped my thinking and my concept during the writing of this book.
Okay, thank you for your explanation, Dr. Putu. I think the main motivation to create your book is how you care with the elderly people, so you can help them to motivation or strengthen their activity daily living and
Yes.
daily life. Okay, thank you. Now let's moving on to the third speakers, Dr. Nilo. The same question. What the main motivation to create your books?
Okay. Thanks for the moderator. To answer or to respond to these questions, there's lots of perspective response. And I would like to go from my own strategy or the perspective, why would this book could be published? First of all, I'd like to go for the data. Like annually, according to WHO, we found out the annual work related to that is more than 2 million. And even for the injury, for the work related to the injury, it's about more than 300 million. So meaning that it is really urgent to do something. And especially, I work with the president of Occupational Health Nursing Indonesia. We work for some research related to the work related musculoskeletal and work related to the fatigue or else. So then we think that it is possibly to create something from the clinical case to the evidence-based practice. So we're more likely to have, like the same like for Portia and also Associate Professor Putu mentioned about how we care to people. So then we go from another perspective to see it. So we're more likely to have some from the clinical case to how it's possible to make into and integrate it into a research. So then we collaborate, then it turns out to be a
To
book.
be a book. So
Yeah.
That's right. That's very interesting to know about that. So, so if I summary your explanation, it's about how research can be a data to be the books, and you focusing on the occupational health nursing, right? Okay, maybe this is the interest to dig more information about that. Okay, now let's moving on to the next question. So I would like to dig more information from each other for each speaker about your books. So maybe the first I would like to ask to the Pro Portia again. So your expertise or your experience highlights environmental conditions are not merely background factors, but I think environmental is essential component for well-being and health. So following that important observation, may I ask you, Prof. Portia, are there any new perspective or approaches that you introduce in your module, especially about, maybe you can describe being more about the environmental health. Please, it's your time.
Okay, thank you very much for that question. It is a very simple thing if we are talking about environmental health, because there are much contact in terms of the environmental health has something to do with the community as well in the inpatient in the hospital. But not only that one. Since Dr. Nilo here is the expert for occupational therapy, we in environmental health, we are still looking in the environment and physical environment of the offices of, let's say, in school, in the university. Everything is connected elsewhere. That is one of the principles of environment of the environmental module that I wrote. The core for this one, the core for environmental health is adopting the 7 environmental principles about the environment and the health. So going back to your question, is that the new things that I think that I can share with the nurses and allied health sciences maybe is that the roles of us is very important. It is part of that module to tell about the role, to tell about the difference among the occupational and environmental health because they many because environmental health is very new in the profession. But I think we are doing it, but no one is writing it except for Florence Nightingale. But I'm very specific in terms of the chemicals that produces around the classroom, around the office. I think the air pollution, the noise pollution, water pollution is part of the module that needs to discuss to them how is it related to health, and at the same time the most important thing is to understand how us men alters the ecosystem. So I think that is some of the a special feature of this of environmental health and environmental nursing module that I wrote.
Okay, thank you for your explanation, Prof. Rosia. If I ask the next question, environmental health is often overlooked, like you said before, that is a new component in nursing, right? So the environmental is a new component of nursing. So if the environmental health is often overlooked in nursing daily activities, so how does your module help nurses recognize environmental factors as a nursing care?
Okay. In the framework that I introduced in that module, that is my the product of my being a doctor, being a PhD degree. I introduced a framework in relation to environmental health nursing. So it depends on if we are talking of, let's say, for example, pathophysiology. So in St. Paul, they adapted that module and we also incorporate that in our core syllabus. For example, in pathophysiology, medical surgical nursing, one of the principles is everything is connected elsewhere. So from that time, especially, for example, the environmental related disease is leptospirosis, asthma, that is asthma has something to do with airborne. So leptospirosis has something to do with stagnant water. So I think I do not know if you have leptospirosis in Indonesia, but I think dengue, because we are tropical country. Because if we do have mosquito carrying dengue, I think the environment has really had a problem. And our nursing care plan really more on the prevention. Okay, better is prevention because according to Franklin, and also prevention is worth a pound of cure. But if we are in the hospital already, we can have the different types of the environmental principles that we are talking into. Like we have, let's say we have nature's knows best when it comes to dealing with surrounding, like old woods can contribute on the asbestos that can be inhaled by us, and we do not know the effect of asbestos, the old woods in our room in the office, or the furniture that is being old. How is it related to health of the people? But dealing with asbestos is really something like dealing with the environment. And another one is prevention of flooding is related to protections of Mother Earth. So as I told you, an ounce of prevention is worth a pound of cure. planting of trees. Maybe we can start there because if we love and save the nature or the Mother Earth, I think it boils down and replicate the good effect in the community and its people and of course to our people in Philippines and in Indonesia as well. So that is really something like I can connect that in the nursing health, the environmental health. That's why I called it environmental health nursing.
Okay, thank you for your explanation. Maybe you could share a simple example of how environmental health consideration can be integrated into everyday daily nursing practice.
Oh, the the roles of the nurses, if we are talking of environmental health, is something to do with the conduction of community environmental assessment, whether in school, hospital, or in community. So we can do the environmental assessment hazard. Then we can do education, like education in community, school, hospital, in terms of environmental risk and advocating environmental health policies, then and participate, of course, in the climate adaptation. So I think that is the summary in terms of the role of environmental health nursing to your question.
Okay, thank you, Professor, for your explanation. So this approach clearly expand the role of nurses beyond clinical setting and strengthen their contribution to community and environmental health promotion. So it's not just only about the clinical setting, but in all of the aspect of the life. So environmental is not just focus one workplace, but for all
we
corners
have
of life, right?
community, hospital, and school.
That's right. That's right. Thank you, Professor. So
Welcome.
maybe we before we go to the speakers, the second speakers, can I show you about the cover of the model? Maybe can you show the cover of the model, please?
Oh, the model. Wait, I'm going to open my PowerPoint for environmental nursing.
Yep.
Wait.
So
Do I
think
have
this is
time
your model, Professor,
for
right?
it? I'm not ready. I'm looking for my.
It's already in the screen, Professor.
You saw it already? Oh, okay, yeah. So that is the cover page of my module. It is adapted by St. Paul University, Manila, and because we do have system, we included that in our core syllabus, especially the 7 environmental principles that I highlighted in my framework. At the same time, I'm looking forward to work with our government and Board of Nursing here in the Philippines because it's been a years now that I am proposing another competency, which is to have an environmentally competent nurse. So that is one of my vision to have the competency of environmental health nurse be recognized by the Board of Nursing and the Philippine government here.
Dr. Putu. Okay, the next question is about what you shared before is clearly shows that changes in mental health is a critical factor that affecting the independence in daily living among elderly. And in your books, I think you discuss it about that, about the relationship between mental health and daily living activities. So the question is, based on your experience, I would like to continue about, are there any new perspective that you introduce in your books, especially about the relationship between mental health and activity daily living?
So thank you. moderator Bapak Arya. So it's been a long proof evidence that depression is one of the common problem among older person. That's the first evidence. And then the second one is older people, because of their psychological and anatomical changes, because of, once again, the natural aging process, it creates some kind of decrease in the dependence level of how they are able to fulfill their daily living activities, such as bathing, eating, toileting, etc. And there is also an evidence out there that mental health, especially depression and ADL, daily living activities for older person, not only one directional model, but it's bi-directional model. Depression influence the independence level, and independence level also influence the depression. In my book, I clearly point out that the support of these three evidence. One is, again, depression is apparent out there for our older person. 15% in my chapter 2 of this book, I presented the data. They feel alone at home. Yeah. So loneliness, aloneness, that is some form of depression among our older person. Especially in Indonesia, we now have around 11% of older person age 60 years and above. Both in rural, in urban, suburban area, they experience similar findings that, once again, depression is an issue. My data found that around 8 to 15% of depression is happening among them. We don't want their quality of life is reduced because of so many conditions. So this book is designed for everybody, actually, not only for the nursing profession, but could be read by those who are interested in understanding how the direction between mental health, especially depression, and daily living activities form a situation that may reduce further for the quality of life. So what is new in my books? This book is considered as a monograph because it discuss one specific issues about how mental health, especially depression, influence the daily living for the older person.
Thank you for your information. That's interesting, Dr. Putu. And the next question is, now let's moving on to the nurses' perspective, because all the participants is from the nurses. So why should nurse pay close attention about this relation? How about your perspective?
Yeah, thank you, Bapak Arya. So once again, we cannot deny the situation that motivation to live, motivation to conduct daily living activities is something that we need to point out, to address and to highlight. So for those who are depressed, this is not happening. So it means that those who are reading my books, hopefully in their daily practice as a nurse, please always take consideration mental health as one thing that you need to consider. It's not only about physical health, because very strong evidence that, once again, depression is out there it impacts activity, daily living, and impacts their overall quality of life. So do not pay attention only on physical health, but once again, please go for mental health issue, especially depression, because it's out there. It's real out there. Thank you, Dr. Arya.
Okay, thank you for your explanation. This integrated that perspective is truly strengthen the holistic approach in geriatric nursing, right? So we cannot just focus on the physical, but we have to focus on the other aspect of the life, such as, for example, psychosocial for this time. Okay, and especially in long-term care setting, I think we need it to nursing. Okay, thank you. Now let's moving on to the third speakers. Let's invite the Dr. Nilo. So your experience clearly shows the gap between occupational health and holistic nursing practice, which is highly relevant in today's working environments. And based on that background, are there any new perspectives in your books about this one?
Okay, thanks, our moderator today. It's interesting questions, actually. So I'd like to go from the real practice in the occupational health nursing. Well, actually, there's, according to the data that we found out before the annual death and then kind of the working related to the injury, and now we found out before I'm working at another countries for the occupational health nursing as well. Then we found out the data over there is they are come from the clinical case. So they are all having the problem in the clinical case by doing the phenomena that it's related to the fatigue, or it's related to how the shifting problems or matters in their own countries. Then it turns out when I back to Indonesia, and it turns out happening as well in here. So then connected to what Professor Tosha mentioned about environmental health, and also Dr. Putu mentioned about how possibly the mental problems could be one of the reasons why those all perspective happening during their realities. And based on that clinical cases, because I now is in the position of the advising for, not advising, kind of the member of the occupational health nursing in Indonesia as well. So we're trying to figure out and connecting between other countries and our countries. So then it feels like we found out the needs of reporting what's happening in the clinical settings should be done, because other countries and our countries is quite different.
Yes,
they have a different perspective on how to do this or that. So then in this book, actually, we found out there is an integration between the culture things, between the culture and other perspective of how the concept of occupational health nursing, of the workers here, what the demands from the workers, what is the job analysis from the workers, so we figure it out. In our book, we try to make how possibly all people try to figure out what's phenomena to be reported, because from that report we can learn, we could find out what possibly strategy that we could have in the real life. So that in our book, we specified how possibly the clinical case coming into the concept and how possibly the theory and based on their culture to be detailed in narratively in our books. So that's how the new perspective from the critical analysis, and then how possibly the workers and then all the multidisciplinary work together to find out and figure out what's happening in the clinical setting and try to write in a book. That's how we try to introduce and persuade them. Yeah.
Great. I think this is very insightful about the occupational health nursing, right?
Yeah.
Okay. So From an occupational health nursing perspective now, we moving on to the nurse perspective. How can this integrated approach improve workers' quality of life? Not only about in the workplace, but the other aspect. For example, maybe if we talk about ergonomics, maybe it's not just for the in the workplace, but in their home, maybe it's give the effect about the condition. So how about that?
Okay. That's another good part. And in our research, because we found out there's the assessment, we developed a protocol. We developed a protocol how to make an examination for the workers. Like how possibly the examination for the workers could be worked for each of the job analysis. So we've done the protocol for that. Okay, so we've done for the protocol for that. And other things, we also thought that related to the perspective of examination, we work on what strategy we can do. Like one of our perspective, actually I brought one of the articles here.
Great.
So we make a development of educational protocol and other things. We made a exercise program to be work for the workers, because we found that doing the systematic review and meta-analysis, we work together actually.
With Mr.
Yes,
Dr. Puji.
Dr. Puji.
Okay.
Well, because it's more about the community nursing as well. So we found out the exercise program, and it has been published in Q1, especially SSEI. So then it means like we come from the very clinical setting, and then we figure out into narratively, into a research first, then we go for the reference book. So basically this book is a reference book that we made together, and then it found that it would be useful for the workers, except only for them to have the quality of life, but also it works for the policymaker. So it means like we could persuade the decision maker to make kind of the rules, or to make kind of the arrangement, how the shifting it works or it matters, how the exercise have been investigated and practices to be shifting in the office and also out at home. So that's how it works.
Okay, that's great explanation. Thank you for your explanation. So this perspective clearly positions occupational nursing as a key contributor to sustainable and holistic health promotion, maybe in the policy process and ads. Okay, I think that's the point of your books create about occupational health nursing. Thank you. Before we go to the next questions about the relevances of each topic today, I would like to give your good news for all participants. So 3 lucky questioners will receive a free copy of the book from the author. So if you have a question, please comment the YouTube comments below. Okay, now I would like to dig more information about the relevancies of each topic, from environmental situation or condition, about the mental health in elderly nursing, and the occupational nursings. Okay, now I would like to give the question for Professor Porcia first. So if you talk about the environmental health, what the difference of the environmental health and occupational health? Could you give your perspective about the differences, that terms?
The difference of occupational and environmental health?
Yeah. Yes, Porcia.
Okay. So, just like what Dr. Nilos have said, maybe the perspective would be on the who are the scope for, just correct me if I'm wrong, Dr. Nilo, but in environmental health, they focus on health and safety of the workers in relation to their workplace and job tasks, while environmental health focuses on how natural and built environment affects the health of the general population, all of us. Another one is the goal for occupational health is prevent work-related injuries, disease, and hazards. And in the aims of environmental health is really to prevent disease and promote health by controlling environmental factors such as air, water, soil, food, and climate. And the last thing, maybe the difference between the two would be occupational health concerned with physical, chemical, biological, ergonomics, and psychosocial risk within the workplace. But in environmental health, it has something to do with concern with exposure that affect communities and population and not just workers. I think that is the easiest way on how I'm going to differentiate occupational health to environmental health.
Okay, thank you very much, Professor. So, for emphasizing the role of environmental factors in shaping health outcomes. So, one of the most significant environment people are exposed to on a daily basis is in a workplace. So, I think what that in mind, I would like to invite Dr. Nilo to the next question. So, how does occupational nursing address environmental health risks? So, within the workplace to promote workers' overall well-being. So, what the relationship of occupational and environmental health in your perspective?
Okay. Well, continuing what Professor Portia mentioned before, that there is almost similar between the occupational health nursing and also the environmental health. It turns out that during the workers, okay, I'm going to give you one example that is the setting of the population among the occupational health nurses is the workers in outside of the workplace, like outdoor.
Others.
Yeah, and the thing is, we found out, the data found that heat stroke frequently happening to them. So it's related to the climate change as well. So that's how occupational, and that's how the environmental health could be share similarities, because during the position of the occupation they have to do that, right? Like the outdoor, they have to digging up all the soil and other things. Then the problem is sometimes the climate could not be predicted, like currently, like in Bali right now.
There's a lot of flood here.
Yes, and then a trust issue, like the trash everywhere. So then what makes it important to be pointed out that the workers could be related with the climate change, with the environment. And how possibly we as researchers need to be done is to find out what is the root cause, and then we do the root cause analysis from that, the clinical case, and then that's why we try to persuade all of the nurses, especially that working in the occupational health practices, they have to report what kind of the cases that it's supposed to be matters in Indonesia. Especially we have archipelago area from the west to the east, so they have a different kind of the weathers and the temperatures over there, and then we need more data from our countries to find out what kind of strategy that we may have to be created, what kind of the evaluation that we should create it for our occupational health nurses, and how this environment could engage with the workers. So that's a new thing that we could create for another study. Yeah, back to you, the moderators.
Thank you very much for your explanation. And now let's moving on to relevance of the about the environmental factors and the mental health. So I would like to invite the Dr. Putu about the relevancies environmental with the mental health. So Proportia is emphasizing the role of environmental factors in shaping health outcomes. So we want to talk about environment. Its impact is often most visible among vulnerable population. For example, older adults in daily lives. So from your perspective, Dr. Putu, how do environmental and psychosocial factors influence the activities of daily living among the adult, especially for the environmental?
So thank you very much. I will answer your question by one case study in one of my older person in a suburban area in Bali. So one lady, age around 81 years old, live with families who are busy working in everyday life. This older person live in a house. It's quite neat, a very typical Balinese house with some steps between the room and the yard. So this older person have difficulties in moving around the house. So every time she needs to do exercise, to do things within their own house, she needs help from the family caregivers. So with the steps, with the distance between the house and the environment, so from gerontic point of view, there is a strong relation between environment and the activity of daily living of the older person. As I mentioned previously, there is a bi-directional model between activity daily livings and the depression. Plus now, if we talk about the environment, it brings a huge impact to the older person independence level of maintaining daily living activities. So if we talk about environmental aspect, especially in Balinese situation, we're not talking only about mental health, we're not talking about the activity daily living, we're not talking only about the environment, but we also talk about the culture, Professor Portia. So because there are some situations culturally, especially in some of the Indonesian aspect, we need to redesign our environment. So that's your expertise may play a very important role, not to not to try to prohibit the influence about of the culture and the mental health or activity activities, but how to integrate everything to support better for the health of the older person. So because of what? Because if we talk about older person health, once again we're not talking only about the quality of life of the older person, but we also talk about the quality of life and the burden of care that happens within their own family.
So I think that's the relevances. So I think all the topics is integrating all the aspects. So from the environmental settings, the daily living among older peoples, and finally to the workplace and environment workplace. So I think it's clearly illustrates that how holistic health promotion. So we highlight the holistic health promotion must be integrated across all of life aspects. So we don't just focus on one aspect. For example, biology, psychology, social, and spiritual, and adding one, like Dr. Putu said, cultures. Cultures, I think it's important thing that we have to consideration as the important one aspect to give improve the nursing care to all age or all condition or in the life aspect. Okay, I think that's the relevances of each our topic today. And
Yeah, Mr.
now we
Papaya,
are going
may I?
to next agenda. Maybe we invite
Hello,
all the
may I?
participants to give the question to each speaker.
May I
How about the
add
committee?
in relation to
And
geriatric
question
health,
from
in relation to
YouTube?
environmental health?
I'm sorry, Proportia, could you
Yeah.
repeat again?
Yes, I am sorry to butt in. I'm sorry to butt in, but I would like to just to give you the relationship of environmental health nursing, wherein I also included that in my framework, is that the environmental health nursing support geriatric nursing by identifying, preventing, and managing environmental risks, and disproportionately affect older adults, thereby promoting safe, healthy, and dignified aging. I think that is one thing that I would like to include in the book of Dr. Puto about the relationship of the environmental health nursing and the geriatric. Thank
Okay.
you. Sorry
Okay.
to butt in.
Okay, thank you, Proportia, for your adding information about the relationship between the environmental and daily activities for elderly people. I think that's important thing for them to perform their daily activities. Okay, now let's check for the question from the participant. Any question? I check before that. Okay, I think there's no question in the all participant. Let's moving on to the maybe we can. Dr. Incha is there. Dr. Incha. Because we will move on to the next agenda about the conclusion and giving token of appreciation. Okay. Okay. Is this the last question for all speakers? Okay. So, the interesting question for all of you. So, where can our listener or participant can find your book? I think it is time for your promote about your books, okay, or maybe your model. But before that, I want to ask first to Professor Portia. That your model is commercially or just for educational purpose? Proportion.
Yeah, I do have partnership in UK because the first time I presented the environmental in United Kingdom. Until now, I am dealing with what do you call this one? The royalty. We are talking about the royalty for that. So it is not available still in Asian, but in UK we are more on the negotiation part. And in the Philippines, it is exclusive at St. Paul University, Manila. But I can collaborate with Etiquette Bali in relation to that module. I don't have any problem with the Etiquette Bali.
Wow,
my
great.
second home in Indonesia. So St. Paul first, then Etiquette Bali.
Thank you.
Okay, thank you very much, Proportia. I think that's honorable to us that has opportunity to read your model. Okay, thank you, Proportia. And next, the second speakers. How about Dr. Putu?
So, yeah, this is the book that we just talking about. So it's published by one of a prominent publisher from Indonesia, D Publish. DEEPUBLISH. It's available in their website, so you can have a look, and you can contact the publisher. And soon I also plan to publish, actually not plan, it's been in the editorial board already.
So already.
Yes, already in a couple of weeks it will be available also for the people. It's all about IADL.
Oh, IADL.
This book is about activity daily living, and the next one is reference book for the instrumental activity daily living for the older person. This is also promotion. Thank you very much.
Okay, that's great. So how about your Dr. Milo?
So I will take this book as well. Thanks, the moderator. If before Associate Professor Putu mentioned about the books as well. So one of my books is concerned on the occupational health nursing. It could be searched in the Maldi literature. So meaning that it's also available on the library, National Library in Indonesia. So for the commercially,
Yeah.
for
That's-
those things actually also have been attached online. So you could easily search from Google and then type the titles and it directly comes to the books. So yeah. That's
Thank
all.
you, Dr. Putu.
Yeah.
Dr. Nilo and Dr. Putu. I already searched in the online shop and found of your books. I think that's so. All the participants, if you want more information about their topic, you could search in online shop or the publishers directly to find their books. So you can buy that and read it to improve your information about this topic. Okay, so the last is about the conclusion. So from today's discussion, we can see that this book offers more than theoretical insight. It challenges us to rethink again about nursing practice, integrating with occupational roles, about the daily activity for elderly people, and environmental context into the holistic nursing care. So that's important thing for this discussion. So in conclusion, this book reminds us that health doesn't exist in the isolation place, but it exists in the workplace, homes, communities, and all environmental where people live their daily lives. Okay, I think that's the conclusion for today. And now we move to the agenda of presentation of token of appreciations. So, before we conclude today's session, we would like to express our appreciation to our distinguished speakers. But before that, I would like to invite the head of the committee, Dr. Incha. Please welcome to our studio, and we'll present the certificate for distinguished speakers. Okay, the time is yours, Dr. Incha.
Okay, thank you so much for the time. Moderator, our moderator is very great today.
Thank you.
Now I would like to present our appreciations, like a certificate to all of the speakers today. First of all, I would like to give the certificate to Professor Portia. The second one, I would like to present the token appreciation to the second speaker, Dr. Idri Putu Dharmasuyasa. Please receive the certificate.
So thank you very much for the
Okay,
token
thank you very
appreciation.
much, Dr. Putu. The last one is Dr. Nilu. Please, I send the token appreciation to Dr. Nilu Dwi Indrayani.
Thank you very much. Really appreciate this work.
Okay, thank you very much for all of the speakers. The last one is for the moderator. Our moderator today is Dr. Arya Mahaputra. We would like to present the token appreciation to Dr. Arya.
Thank you very much, Dr. Incha, for your appreciation.
Okay, thank you. Okay, that's all of
Okay, thank you very much, Dr. Incha, to give the or to present the token of appreciation. And now we are the last agenda of the today's session. It's a closing. And before that, I want to say that on behalf of the ITEKAS Bali, I would like to express my sincerely gratitude for our distinguished authors for sharing their knowledge and valuable perspective. And thank you for all participants for your active engagement until this agenda. And I hope today's discussion inspire us to practice, teach, and maybe have a future research project about the nursing in more integrated and holistic way. So I am the moderator, Arya Mahaputra, and with that, I officially close this book review sessions. And have a wonderful day and stay healthy. Thank you. Bye-bye. Thank you very much for all speakers. Thank you.
Thank you.